Someone wanted to know how microneedling is different, pros, cons versus a Plexr shower. And as far as active feel goes, using it in conjunction with microneedling, if you apply it before or after.
Okay. So yeah, I'll take that unless you have something you want to add on that, Arash. So in terms of the actual process itself, I apply it after the microneedling. So we use the microneedling to create a mechanical trauma. So the needles are going to create opening channels within the skin. And then we put it on the ActoFill after the product procedure. So whether it's ActoFirm or ActoReverse, we put that on at the conclusion of the procedure, let it soak in all the channels. And we also send some home with the patient that they're going to apply usually within 4 hours of the procedure. So it's a two-step application. In terms of the Plexr shower and how does that differ from traditional microneedling? So there's a few things. So first of all, it is in general a more comfortable procedure than microneedling. And so from patient's tolerance standpoint, it's more comfortable. Second of all, we're using plasma energy to basically create these nano channels or nano openings, which is going to help with our product delivery. And so conceptually, we're basically creating channels instead of with a mechanical trauma with the needles. We're doing this with plasma-based energy. So there's a couple of things about that that are beneficial. So we know that it can be very inflammatory with the number of needle sticks that we use. And so the more aggressive we are with microneedling, the more trauma that we create, which, sometimes it can lead to problems with scarring, especially in our darker skin type patients. We can get things like our post-inflammatory hyperpigmentation. So we got to worry about that a little bit. And so we don't really see that with the Plexr shower. So we're using plasma energy, but it's spread across this triangular shaped tip. So it's spread across a large surface area to create these micro openings that are going to now allow us to deliver the product. And really, whether we're doing this for if we're doing this for collagen production, your product that you're putting on at the end is just as important as the way that you're creating those channels. And so what I like about the Plexr shower is I'm able to create those channels of this plasma energy without having the mechanical trauma on the skin that they're going to now have to go and heal from. And there could be some problems with inflammatory changes. Now we do microneedle in all skin types 1 through 6. We Plexr shower in types 1 through 6. But I don't worry much about pigment changes with our shower as I do with the microneedling. In terms of strictly a business aspect of this, with our microneedling, we're going to have to numb the patient. They're going to have to sit with that on them. So depending on your practice setup, so if you're in a salon suite or a shared space, then that's going to take up time that you could be treating a patient while they're having to sit with numbing on for their microneedling. For the Plexr shower, we don't have to numb at all. So we just straight away do the treatment. And so in general, I could see 2 patients per hour. And so in the same time, do 2 Plexr showers as it would take to do 1 microneedling. And so, when we start looking at results, the results are typically what our patients are telling me, what I'm seeing, superior with the Plexr shower to traditional microneedling. But their microneedling has been around for a long time and patients are familiar with it and still request it. So I had a little bit of trouble in the beginning getting patients to see the difference in the two. And so what we did is put it as a similar type of procedure, although I think the Plexr it gives superior results. Our price points, we put around the same area. And now what we've done is gradually increase that because we did this word of mouth, right? It took a little bit of time to get some of our own patients, not just showing what the company shows, not just showing what, Med Results is going to give me as before and after, but now actually being able to speak to it and say, look, not only personally have I seen this, here's some patient testimonials, here's some actual results of what we've done. And I show a few pictures, like the first one that you saw in the slides from my practice, and they see that and they realize it is a different procedure. It is superior. They don't hurt as much and they get better results. And now I can charge more for that. And so we're still in that process of adjusting our prices up. So that was a little bit hard for me conceptually in the beginning to think of where am I going to position this. And it actually was a little bit difficult for my staff to have those conversations. And that only took a few months because literally you start seeing those results and then it speaks for itself and you don't have to continue having that conversation over again. Arash, how do you coach practices on comparing those two?
So, so I mean, you nailed it actually. One thing that I have, the difference between microneedling and Plexr shower is that microneedling is not ablative. So you are not removing the tissue. So you are just causing a micro injury, micro trauma. With Plexr shower, you are actually, what we call Plexr shower is nano ablative. So it is ablative, but it is microscopically ablative. And it is very important because when you remove the tissue, you have to regenerate the tissue. You have to recover from that removed tissue. And that is the source of that lifting that you see in people. And also, the other thing is, after Plexr shower, the skin is just like a dry sponge. It sucks everything in. So compared to microneedling, which after that, skin is like a wet sponge, which is bleeding and is not willing to receive more. So I suggest for people who want to use microneedling with Plexr shower to also apply Plexr shower before microneedling. So apply it before, do it while this, and then also after.